The suitability of NGOs to care for patients transferred from Life Esidimeni facilities has again come under the spotlight at the inquest. Former Deputy Director General for Mental Health Services in Gauteng, Jacobus, who was responsible for overseeing the NGOs, was grilled on staffing shortages, physical environments and a long list of non-compliances which posed a risk to the mental health care users. The inquest was established to determine who should be held criminally liable for deaths of more than 140 mental health care users. In 2016, 144 mental health care users died of hunger and dehydration after being transferred to unlawful NGOs. SABC News senior reporter Griselda Lewis is in studio and has more for us. Over to you, Griselda.
Well, a very good afternoon to you, Nompu. So the inquest has heard of how mental health care users were placed at NGOs with no proper food specifications and that they did not even have service level agreements with the Gauteng Department of Health. Back on the stand again today, lawyers representing 44 of the deceased families accused the former Deputy Director General for Mental Health Services in Gauteng, Jacobus, of not making full disclosure on the state of facilities that the patients were sent to. Let's take a listen.
We've seen that Precious Angels is not it's not at either of these addresses, right? It's not at Kalafong and it's not at Linwood Road, and it was instead it was located at a house in Attridgeville, correct?
Yes, Council.
But is there an actual license for that Attridgeville site?
Not that I can recall of, Council. Should I explain further?
I just want to know, was that site licensed?
No.
Thank you. But mental health care users were sent there, correct?
Yes, Council.
But this finding shows that the license was not properly issued, correct?
Yes, Council.
Nompu, you recall why this is important. It's specifically important because you recall during the first sittings that had taken place, the arbitration that was chaired by the retired Deputy Chief Justice Dikgang Moseneke, there had been a couple of concessions that had been made that the NGOs that the mental health care users had been transferred to were unlawful. So this, again, a demonstration that no proper process was followed in the removal of those patients from Life Esidimeni to those facilities, and that the entire process itself had been rushed. So the lawyers representing the 44 families of those deceased are continuing to go step by step to those NGOs that these mental health care users who had passed away were moved to, in trying to poke holes in some of the testimonies that had basically trying to paint a picture that all was above board.
Thanks very much. There, my colleague Griselda Lewis.